The following program contains mature subject matter. Viewer discretion is advised.
The CDC has sounded the alarm, stating that STDs like chlamydia, syphilis, and gonorrhea are at all-time record highs. And Dr. Nita, I want to start with you because you're an OBGYN, and obviously you're counseling a lot of people on this. What can people and parents do to make sure that they don't become one of these statistics, so to speak?
We just have to make sure that we are comfortable having uncomfortable conversations about sex. And especially in the case of teens, parents and guardians love them more than anybody in the world. So they just have to make sure they're protecting them through education. Like, for example, if a teenager comes to my clinic, a lot of times I will specifically say, are you sexually active? And they'll say no. And then I'll say, do you have oral sex? And they'll say, oh yeah, I do that. So sometimes teenagers don't understand that oral sex can actually lead to gonorrhea, chlamydia, syphilis, herpes, human papillomavirus that can be associated with throat cancer, and very rarely it can also lead to HIV. So we just need to make sure they're educated about those things.
As an emergency medicine doctor, you often see sexually transmitted infections presenting and people don't know what's going on. And it can be a very frightening experience. And quite frankly, even in my own life, seeing that, you're like, okay, I do not understand why people don't protect themselves more, because you do not want to deal with these. You can see some of these pictures we're scrolling here of what these infections may look like, so you know what to look out for. I don't want to say that generationally people are more flippant towards sex now. I don't know. I'm not part of the new millennial generation, but I do worry that without sometimes visuals, without some of these, I don't even want to call them scare tactics, but if they're at all-time highs, we need to get people to wake up somehow.
I agree. And I don't think it's just millennials. I have had a lot of women newly divorced in their 40s and 50s.
And 60s.
And 60s. You know, we look at the rates of HIV in assisted living homes. People who think, oh, I'm not at risk. I'm not in my 20s anymore. I'm a divorced wife, and I'm going on a dating site looking, and I'm probably not at high risk. These aren't high-risk people. So I probably am going to be fine if I just do this 1 or 2 times, and then all of a sudden they're coming to me saying, guess what I just got diagnosed with? I'm devastated. I have something that can't be cured.
Are we at a point where we insist that if you're going to start a relationship and be sexually intimate, and particularly in a scenario where you're going to have a monogamous, not use protection relationship, where we have to say, look, I want to see your lab results?
Yes, absolutely.
I mean, or you can with your name on it?
Some people do that.
Yes, or go to the clinic together, and then realize that if you were exposed a few weeks ago, then the test may not be positive yet. So I would say be in a monogamous relationship for at least 6 months, and then get tested, as long as both of you have been monogamous for 6 months, and then you can say, okay, we're good, now we can.
Incidentally, a lot of the sexually transmitted disease panels do not regularly test for things like herpes simplex also. So you have to have a game plan together, because it's one of those things that a lot of times people will be completely at a loss, and they'll say they got tested, but maybe the only thing they got tested for was HIV.
And you know what?
You have to know what you're getting tested for.
People may not have active lesions, yet they're carrying the disease process.
Exactly, and Dr. Orton, that's a great point. So what people don't know is those pictures that we saw, I think it's pretty safe to say that most people would say, oh, wait, let's not have sex right now.
Yeah.
But the thing about it is...
I'd be safe to say, we're never going to have sex.
Yeah, but the thing about it is most people with gonorrhea and chlamydia have no symptoms. And even if you don't have symptoms, for example, with chlamydia, that can still lead to something called pelvic inflammatory disease, which can cause infertility in the future. So just remember, it would be nice if everybody looked like that, so you could be warned and say, oh, maybe I shouldn't have intercourse with this person, but that's not the way the world works.
And I think it's also important to highlight that there should not be shame associated with these diseases. Look, these are infections, just like you catch a cold. Look, these things get passed from one person to another. Doesn't mean that you're being promiscuous. Look, it can happen, and I think that's why it's important to have an open dialogue with your doctor.
And wearing that condom is just as important as fastening that seatbelt every time you drive.
But it's
wearing a latex condom and realizing that not all condoms are the same. So latex does a great job of protecting against sexually transmitted infections and pregnancy, whereas lambskin condoms do not protect you from sexually transmitted infections, and a lot of people don't know that.
And the most important thing is, if you are sexually active, if you've not been tested, you do not know. Since so many of these do not present with symptoms necessarily, you have to get tested. We're going to have some of these images of these sexually transmitted infections on our website, along with more information on some of the symptoms you need to look out for, and also things that you may want to talk to your doctor about being tested for. We'll be right back.